Even when I came into the States, like 20 years to 2000, I remember working at the health facilities, and one of the things that was very peculiar was the fact that most of the time people come in, and they come in at a time that we can do little for them, and the children will die. As a pediatrician, I was very worried, and I used to wonder, what kind of people are they? Why are they not coming at the time they are supposed to come? And why is it that it's when the babies are almost about to die that they bring the babies to the facilities? I was blaming the people as at that time. Little did I know that the fundamental thing as at that time was the fact that they didn't have the funds, they didn't have the money to pay for the services.
Bayelsa was one of the states that had poor performance in some health indices, particularly immunization and other service delivery. The PMCMOU exercise, which is supported by Gavi in collaboration with UNICEF, has been an activity that has been going on in Bayelsa State for the past 3 years. There was a lot of gaps noticed. People assessing those facilities was also a major gap. And when you look at assessing those facilities by caregivers, you talk of finances, and that's where financial protection comes into play. How do we improve financial protection for the community, especially the vulnerable population? We have people that can't even afford 3 square meals. How do you start charging them for health services? So the financial protection idea is where we look at basic insurance. Now for Bayelsa State, we have the Bayelsa State Health Insurance Scheme that has been actually functional, which has been very good for Bayelsa State, and we could see the impact so far.
So with the inception of the Bayelsa Health Insurance, there was a kind of turnaround, so to speak, in the sense that these same people that were not coming to the hospital are not coming to the hospital. We are beginning to see them not at the late stage, at the time when we can do nothing.
PAC-MOU exercise, or the Gavi exercise we come into, was how we could enroll more. We have a lot of people enrolled, but it focused those employed, the federal workers and so on. Where do we come into in terms of vulnerable population, those that don't have a source of earning or a source of living? One of the activities that happened last year was the enrollment of 10,000 vulnerable population across all the LGAs in the states.
The government and the country wants to cover each and every person in the country under the insurance program. And we are mainly focusing on children. Okay. So we decided to work with the state and expand this particular insurance program to the children and the mothers particularly. So those are our main target population, and we are working with the government of Bayelsa under the equity program. Okay. We are trying to support them to target this particular population, enroll them into the insurance coverage, so that the overall access for the services of maternal and child health care can be improved in the state.
Yes, sir.
And with that effort, we are supporting around 10,000 people in the state.
10,000. Today in Bayelsa State, we're experiencing a significant and epochal event. We're witnessing the launch of an amazing, beautiful healthcare initiative which the Bayelsa State government has put in place in partnership with Gavi, the Vaccine Alliance, and UNICEF. The enrollment of 10,000 vulnerable Bayelsans into the Bayelsa Health Insurance Scheme.
Under the Basic Care Provision Fund, as partners are coming, Gavi, UNICEF, Equity, the infant mortality and maternal mortality has grossly reduced because from the inception, the focus is on pregnant women under 5. Before the collaboration, people were not coming to facility as they are trooping in now because it is hard on them to pay for the services. They can't. Even if we go into the community and see somebody dying and say, bring to the facility, they'll say, we don't have money to buy drug, oh, we cannot come. Oh. So the patient flow was not there as it is today. But now you see that with the coming in of this Gavi, UNICEF, basic healthcare, because the drugs are free, services are rendered free, laboratory free. So they are now coming. They felt that it is their own benefits. They are the beneficiaries and they have to make use of the facility. So the facility has been utilized well as comparing it to then when they have not come in.
My name is Mercy James. I be businesswoman and my husband now farmer. So as I hear this program, because of the way I be the way they tell me about hospital, where the hospital things cost, now make they call near hospital there. So as how yesterday they do this free treatment by Gavi and UNICEF. So when I heard the free treatment, now I say I come carry my children, they come. Because my children they always they sick. When I go chemist, they go mix waiting. When I take medical, they go mix another drugs for me. So I need to know waiting the drugs they really they work.
My name is Ayowe Dugood of Ode and Movo, the OIC of Yenegua PHC. In this health center, we do family planning services, immunization, outpatient treatment. We also carry out nutrition services. We also do health education and other health-related services. With the help of this program, it has improved our antenatal sections. The number of women that comes for antenatal has improved. Number of deliveries has improved as compared to the past years. The number of treatments done, OPD, has improved, and generally our general attendance has increased. The number of enrollees has improved from last year to this year as well. The program has really touched the lives of many persons within Apia and Atisa area, especially Ward 1, which this facility is sited in.
My name is Sokare DK, the officer in charge, Primary Health Care Center, Fangbe Community in Yenagua local government. I'm a community health officer who I worked here for the past, worked about 30-something years, and then deployed to this health facility. The facility has been on ground since 2000. The facility has been on ground, and to be very, very frank, how the people are assessing the facility compared to that time, this time it cannot be compared. The percentage has increased tremendously, and the indices too also has increased our indices. Before the program, I think a month, when we used to submit our data, maybe something like 60 something, but it has even extended, if not to maybe 170. Even when we come to maternal health, so people are coming here to register free. We cannot compare at all. That before this time, if they come, they want to register. Oh, now say if you want to register, maybe it's 2005, you do PCV test and do whatever, but most of these things too are free. So people are coming. There's no anybody. We have antenatal and our antenatal every Tuesday. So when you come on the antenatal every Tuesday, anything we do at an antenatal is free.
Because they provide everything. And looking at them, we have to work towards they are not having any issue. So from then, as we look at it, rarely we don't even have maternal mortality. Even infants, there are cases, one recorded only all through this time. Maybe that one too, we say lack of antenatal care and poor nutrition that cause the infant mortality. For it has been reduced it has been reduced. Because we know our limitations as we work here, we do prompt referral to higher facilities for proper management, and we identify cases that are not supposed to be in the system. And we attend to pregnant mothers and infants promptly, even in immunization. So for that reason, I think this infant mortality and maternal mortality is really a focus in our hearts, that we are working so hard to see that we don't even experience anyone.
So another thing the program looked at was the renovation of some of those dilapidated facilities. How can we strengthen to make sure beyond just the renovation we have water resources so our people can access clean water supply? Looked at engagement of some healthcare workers. So part of this program was to engage 809 health workforce, and that has improved the health workforce in those facilities.
My name is Mary Winnie Ovo. I'm working in Fangbe Health Center here as a Gavi volunteer. So to be sincere, the program has really impacted many people, including I, because that's year before last that the program was not on. For we to even get pregnant women, we get to walk maybe from house to house and call them, Madam, come for antenatal now. Today is antenatal day. But during this program, because the program is on, once you just do the announcement, before you know, they will all gather here, both antenatal and immunization, because today is our immunization. And you can also see the crowd, the women that are here. They are more than, even 2 times better than that of year before last and last year. So the program has really helped us. Even we, the health worker, has helped us, has even helped the health facility and the community.
When we started, we had roughly, from the 10,000, we had 2,000 or 3,000 within the first month. And it's also due to awareness, creating that awareness. So we could see it started, and then as at the end of December, we're having roughly 4,000 or 5,000 of those people accessing those care. So it tells us that people are now, they are sensitized, they are aware of it, and they are actually using it. So we could see generally our deliveries, our immunization figures. If we look at our DHIS report as at 2023, we could see that a lot of things improved. We are talking of people, if you talk of immunization, we had people that were just 16% of our children being fully immunized. As at the 2023 survey, 63% of those our children were actually fully immunized. So it tells us that a lot of people are now accessing those care. If we look at a lot of things from our family planning services, for our deliveries, we know we are still growing, we still have a long way to go, but we could see that improvements. I think our delivery, skilled bed delivery, was prior to the survey was at 20-something%. Now we have it at 56%. So we see that yes, there's an improvement in that. We know we still have a long way to go, but it tells us that giving this enrollment, or knowing that these people can access this care with minimum or no costs, tells you that these people are willing to use the service.
My name is Grace Francis. I'm from Bayelsa, indigenous of Nembe. And when this program never comes, sometimes you know well, you will come to think you will go buy drugs. If they call the bill self, sometimes you will come say, this kind of money, I don't get that more. But since when I joined this program, at least different day, anybody hot, when I come, they give us drugs, injection, like that. So we still thank government for these good things when they carry come give us, when they use help ourselves and the children and the family. When I born that my boy robot, that boy is a bit sick. Go carry around, go here, run, go like this. Sometimes we won't go health center self for that way the woman affect, because I did born am. Sometimes when the bill come like this, I always get shocked. I go say, how I go do? I go run around. Sometimes they go write the drugs, the syrup self. I go pick am for tablet because the money no reach. But since this program come, I dey enjoy am, because even though na night, I come here sef and they answer me. So I want say make government just empower us like this so that mothers dem when hand no dey, father no dey, make dem dey help us.
My name be Gladys Nicholas. I be 26 years. My community na Bebelebri. I come from Bebelebri. If I dey get some kind severe pain, then if I come here, then they attend to me very well. Then they give me drugs. Sometimes then they tell me to climb bed, then go give me some treatments. Since when I start the program, when I come here, they never collect money from my hand. Go tell them thank you because number one, then they less my burden, like money wey I supposed to pay, I need dey pay now. So I wan tell them thank you as dem dey help us, dey help my oga sef. The money wey we supposed to carry dey come do all these things, we dey use am dey do other things. I dey tell them thank you, may God bless them and give them more strength to dey do this work. Thank you Gavi, thank you UNICEF, thank you Bayelsa State.
So since I hear about this free program, as I come, they come dey give me drugs. And me sef, my children sef. If they sleep late sef, me I come dey feel say be they wan sick. But now because of this free treatment, now anywhere they sleep, now they even fear again whether they wan sick or they dey sick. And the program dey help me a lot because I be businesswoman and my husband na farmer. If I wan go buy drugs, I know how much I go take go buy drugs. But for now, this free treatment dey now, I don dey come treat my children free now. Even me myself sef, I dey come take free treatment for health center anytime my body worry me. So I just thank God and I thank the people do this program. Now, may God just bless them. May they no stop. May they continue this program so that it go help us where we no get money to go hospital. So I want to tell them, may God say bless us and give them more years to the help people when no get to the go hospital.
My name is Elizabeth Emmanuel. I'm a mother of two. I'm from Abia State, but I'm based here in Bayelsa. I stay in ADP. I don't have the opportunity of this beneficiary. So I was able, if you don't have enough money to take him to the hospital, you just get drugs from the pharmacy or any around there so that you can look to be fine. But since we have this one, we become beneficiary. So just for you to pay the transport, came to the pharmacy, they will just give you the drugs, and also they will also run tests before they give you the drugs. They will not just give drugs like that. They will run the tests before they give you the drugs, so that the baby will be okay. Because we normally come to the day that the appointed time they say we should come, so we always on time for the immunization. So we don't miss any of the day. That is why if anytime that you're sick, the sickness will not be much because we have already immunized her. So just normal paracetamol, vitamin C, all those of it. If you do not take her to your immunization at that time, maybe sickness might be much. But since we are going for immunization, it's just normal minor sickness. But when they come, they will give us the drugs that will be okay for her. So we are very much appreciate what people have done. So we pray that God will continue to give people more money for you to pay for us, because before then we are not able to go to hospital. But since this program comes, since people are paying for us, so we are able to come to the hospital to collect what, but God will protect and also guide and also give you more things to also pay for on our behalf, so you can be able to take our child to the hospital anytime they are sick.
I have to appreciate them because what they are doing, I never even like this one that they are innovating self is much by my expectation. You understand? A very great thank you to them for job well done, for considering us. We are not worthy of these things, but it came our way as a favor. So we are just appreciating them. Then I want to plead with them for the continuation of the program. They have to continue because we are seeing that the challenges, health challenges in the villages are much. And this is the program that is helping the system.
To thank Gavi and UNICEF for the basic care provision support they've given to Bayelsa State. I want to really appreciate their effort in making sure that Bayelsans are well taken care of as regards to health, especially for the less privileged, disabled, under 5, and pregnant women. The program has helped in many ways because it has reduced disease burden in the state. It has also helped the less privileged to have access to quality health care. Some persons doesn't even have the money to even take their children to the hospital, but with the help of this program, they were able to access good health care.
That the policies that made this program to come on board, they really have the foresight. They really tried. You know, one thing is to formulate policy and one thing is to execute it. But one thing I used to like, I worked in this sector about 30-something years. One thing I like is that without NGOs and UNICEF, Gavi, all these people coming, FHR3s, nothing else cannot do anything. Government is doing their part, but these partners is also their very much. You don't see what I cannot say. I mean, it's only God that is sending them. And so the message I want to send to them, more grace to their elbows. Wherever the source is coming from, we are even praying that they should continue to support the NGOs to grow.
The healthcare, improved health systems and improved healthcare and well-being of the people is not only government's responsibilities, everybody's responsibility. From UNICEF and from the government side, I assure that we are working towards improving the healthcare systems and healthcare services in the states,